when I started remembering, I guess I couldn't speak. I just grunted mostly. And I couldn't read. I was an accountant. I couldn't add. I couldn't subtract. So it was pretty hard. My name is Christopher Pass, and I'm here because I had a hemorrhagic stroke, about 5 months ago. So, it was recommended to me that they did some pretty amazing work here. So.
Okay, so my name's Emily. I'm a physical therapist at the Recovery Project. I've been working here since 2015. My student and I just started working with Chris just a few weeks ago. So we see him 1 day a week, and he's seeing Danielle, our PTA, 2 days a week. He's doing really, really awesome. It's been really cool to see his progress since he started coming. I actually gave his tour when he was first interested in coming to the Recovery Project. And he came in with a manual wheelchair, and then when he started therapy, he was using a walker, and now he's walking independently with a cane. So just to see his progression has been really awesome. And how quick he's progressed too.
I won't forget it. It was September 30th, and it was a Sunday, September 30th, and started much like every other day. But when I woke up, I knew something was different. I couldn't move. I had complete awareness, but I couldn't move anything. Fortunately, my son was in the room playing Legos, so I, as calmly as I could, I said, kind of go down and get your mom, and have her come up here. So, actually, I remember the paramedics getting there, and then I don't remember anything for about a month. So I lost a month of memory. But fortunately, due to my age, I've been working hard at it. I treat it like my job. So my speech has gotten tremendously better. I can read. I can do math. So I've gotten a lot of functionality back. So I'm encouraged by my progress, for sure. Yeah, no, I read. I read like every book imaginable just to help with the mental side. In the beginning, it's kind of hard for me to think. I couldn't read I couldn't read the. I couldn't read and. The letters just didn't make any sense to me. And then when I tried to read, I would get an excruciating headache, and just overwhelmed from trying to focus and read the words and stuff. But I built up my tolerance to that, and I read for an hour every day today. So I've come a long ways in not that long of time. I mean, I'm not where I want to be, but I'm a lot better place than I was. My family. Basically, I have a young son and a daughter, and I want to be better for them. I was a pretty active dad. I coached my son's football, and just out in the yard throwing the football around and going up to the school and playing basketball, and so that's what I think about when I feel like giving up. I said in the beginning that not even knowing if it was possible, but said, I want everything back. And for the first time, I said it so many times that I actually believed it. So now I feel like it's possible. And it's going to take a lot of work, but I'm willing to do the work. I'm willing to put in the work that I need to do to get where I want to be. I want to coach again. I want to be able to run around with my kids and chase them around and be the dad that I used to be.
He has such high motivation. It's really great to see all of his goals and everything that he's working to get back to. Just like hunting and fishing and hiking. So we're trying to translate some of those goals into therapy.
Yeah, it's definitely made me, like I was a pretty good person before this happened, but I feel like I'm a much more rounded person now. I feel like I have more empathy than I did before. So I just feel like it's, for the first time, basically, and for the first time in my life, I feel like I'm exactly where I'm supposed to be. I know that might sound hard for some people to believe, but I know that God's got a mission for me, and I'm just praying to do His will.
My name is Katie Middlestadt. I'm the Certified Occupational Therapist Assistant working with Chris. I am one of the treating therapists that works with him. I think I've seen him the most, actually, of our team as far as OT goes. Today, we worked on a couple of different things. We worked on shoulder maze, but the maze can be used for more than just your shoulder. But today we used it for the shoulder. So he had to take his right hand, start at the bottom, work all the way across his midline, and trace all the way through. So up, down, left, right, everywhere, starting way down to the left and then way up to the right. And reaching way up to the right has been the hardest thing for him. I'm so impressed with him today because it just was fluid. It just came right up instead of like a jerk, jerk, jerk movement. It just right up there and he was able to go through the maze. It's not easy for him. It is difficult. It takes a lot of effort to make these motions to come up into this high range motion. So we started with that, and then we went into a 4-point position where he's on his hands and his knees. We do this for weight bearing. It promotes feedback to the brain to remind the arm and the nerves what it's supposed to do. So we started there, and then we challenged him with a reaching task. So we had him thread the needle is what it's called. And so we had him thread the needle underneath, grab the cone, so working on grasp, bringing all the way out to this hard abduction motion, and to set it down and release. So it's a lot of multitasking. There's a lot of multiple things going on with his shoulder. He did 4 sets of 8 cones, which is amazing, and he even switched. So we started here and we did right hand first, and then he had to take all the weight onto his right side so the left could do it. And you'll see in the video that it is the hardest motion for him is to maintain that weight. So think about a shoulder that's weak and then you put all of your body pressure on it. To be able to stabilize that, to do the other side is what's most challenging at this point. So those are some of
the staff is really friendly, and they have I think they try to customize a plan to accomplish my goals. You know, everybody has different goals, and you know, and they work with you to, you know, like I was an avid, you know, I was an avid bow hunter and golfer, and you know, I love the outdoors. If I didn't have to stay inside but to sleep, that would be fine with me. So they really have, you know, sat down and asked me what my short, medium, and long-term goals are, and basically helped create a plan to, I think, accomplish, you know, all my goals. My goals are pretty high. Like, I want my life back. I want everything back. And for the first time, I think that's actually possible. It's going to be a lot of work, but it's going to be possible.
We've also been working on holding a bow. He is a bow hunter, So we took a body blade and we stuck a red TheraBand on it, and then he has to stabilize with the right and pull back with the left because he's usually holding with the right. And he has to be able to sustain, I think he said 72 pounds of pullback. So right now we're working red TheraBand to pull back, and he can sustain that for over a minute and a half. And then today we also added a weight. We added a 1 pound weight to just give it an extra little isometric movement in here to really kick that contraction going. And he did that really well, more smooth than before as well. So really impressed with him today.
And today we started working on more single leg squats and just to really activate his hamstrings, quads and hamstrings together. Because that's just going to improve his daily routine, being with his kids at home. And then we added the weight, so it was a weighted vest basically. We used about 12 pounds, and that was to improve proprioception and really get his muscles firing a little bit more, especially in the hamstrings. So just an extra challenge, make it more like real life.
I've made tremendous strides since I've first started coming here. Like I had a lot of challenges. Even getting dressed took me like 20 minutes. Like I sometimes spent 5 or 10 minutes on putting on a sock. I wouldn't let anybody help me. I just struggle with it, and kept trying to just there's a Kenny Chesney song that says it pretty well. I'm not the man I want to be, or I'm not the man. How does he say it? The song is Building a Better Boat. Like, I don't know if it'll float, but when I get done, the boat may not float, but I'm learning how to be a better man. I just, like that song rings true to me. I'm just focusing on today and making the most out of today, and just having faith that tomorrow will take care of itself. Mm-hmm. Yeah. Basically, everything was difficult for me, like from getting dressed to walking to the bathroom and back. Like, I would be exhausted. They've really worked with me to help build up my stamina, and I put a lot of work into it on my own, and I do a lot of extra credit, so to speak. I look at everything as an opportunity to strengthen myself. Like, I look at things a lot differently than I did. Like, everything is therapy. Like, I've never folded so much laundry before in my life, but it's, fine motor skills and stuff like that. So I just look at everything as an opportunity to improve, and I'm a very competitive person, so I time myself constantly on tasks, and I want to beat my time, and that's how I know I'm making progress. And I don't even have to think back that far. Like 2 months ago, I couldn't lift my arm. My whole right side was paralyzed. So I've made significant gains in short periods. So.
He came in here not being able to lift his shoulder up into this motion. It was maybe a fourth of the range. And even out for abduction, maybe a fourth of the range. And now his huge success is he can bring it all the way up, he can bring it all the way out to the side, and it's less painful, it's less effortful. It has really improved his ability to get dressed, to pack lunches for his kids, he actually has been outside cleaning up after his pets. He attempted shoveling the driveway. He has been doing a lot of functional things now with it, so his quality of life has just gone through the roof. He's excited to come. He's highly motivated. He works really hard. And those have been probably the best things that I've seen from him. We've also had some setbacks with some pain. but that's normal. I mean, you're going to have that when you're working a muscle that hard. And he's just been doing really well. He's come to, I think, a great point. He still has a ways to go. Next couple focuses are on childcare and maybe some more household tasks for OT, but he's doing great.
Well, I would say that, I would definitely recommend TRP. They've done a lot for me personally. They'll customize a plan, and they'll guide. They'll give you the roadmap of what you need to do. It's not going to be easy. It's going to be probably the toughest thing you've ever done. But if you're willing to put in the work, that they'll get results for you. Well, actually, you'll get results for you. But you have to. Motivation starts with yourself. Nobody can will you to get better. You have to want to get better. And if you have that want and that desire, they'll push you to your limits, and in a safe fashion, but they'll push you hard, and they'll make you work your butt off, quite frankly. I'm literally taking one day at a time, not worrying about tomorrow, just making the most out of today.